Thank you, Chair. I'll be presenting a global overview on fatty liver diseases and what this means for the African continent. Here are my disclosures. I'm presenting on behalf of the EASL International Liver Foundation, which is a global nonprofit organization committed to increasing the quality of life and reducing premature mortality for the greatest number of people by improving liver health. Our vision is nothing less than that everyone deserves a healthy liver. So why should we be concerned about NAFLD in the world or even in Africa? Well, firstly, it's a global issue with as many as 1 in 5 people around the world affected with this condition. There's a significant impact. NAFLD has serious health, economic, and social implications, and it's a complex challenge requiring us to work across disciplines and sectors to find solutions. Finally, it's a silent condition. NAFLD has received little attention from policymakers or even from the public health community. The 4 priorities that guide the foundation's work are to advance the public health research agenda by developing knowledge that provides a basis for action on NAFLD, from models of care to public health measures. This year, we're working to establish a global coalition and network to which all of you are invited to be a part of, and we'll be convening and collaborating with experts and organizations across sectors and disciplines and providing platforms for engagement. For years now, we've been sounding the alarm and advocating for greater attention and action on this underserved issue. And finally, we're engaging and supporting the NAFLD community by providing a platform for patients and patient advocates to engage in the dialogue and shape the discussions. What's the NAFLD prevalence in Africa? That's quite a challenge to answer. You'll see 2 studies on the right of the screen from Sudan and Nigeria with rather small samples. We know very little about the situation in Africa. We know more about NAFLD in other countries, as you can see in the figure on the left. But what we do know is that while national prevalence data are scarce for sub-Saharan Africa, the prevalence of risk factors is highly prevalent in Africa, and that will increase the burden of NAFLD over time. Here you see the obesity prevalence in African countries, and we know that obesity rates are rapidly increasing in the African region. With this, the prevalence of non-communicable diseases, including NAFLD, will also increase. There's a real need for adequate policy responses to address this challenge. A recent global review of NAFLD and NASH related to policies that the foundation conducted in 2020 followed an earlier European study. We went from 30 countries to 102 countries, including 15 from sub-Saharan Africa. We used that data to develop a policy index by coding it into 6 domains: policies, guidelines, civil awareness, epidemiology, detection, and management. And then we categorized the responses as high, medium, or low level based on predefined criteria and conducted a multiple correspondence analysis. That data will soon be available. It was presented earlier this year at the International Liver Congress. But what we found was that no country was well prepared to address fatty liver disease. Close to 1/3 of the 102 countries received an overall score of 0. The results can assist countries in identifying priority actions to improve their NAFLD preparedness. Obviously, in some of those countries, a lot needs to be done, and in others, a little bit less, although no country scored very well. We can use this index to track national, regional, and global progress over time. So some of the key strategies and policies for addressing NAFLD, well, we looked at the inclusion of NAFLD or NASH in the national or subnational strategies of key conditions or diseases related to NAFLD, like obesity or diabetes. And as you can see here, most countries don't even have strategies for some of these issues, but when they do, they don't address NAFLD or NASH at all. So if you look where sub-Saharan Africa is highlighted, NAFLD and NASH is not addressed in any of the obesity strategies, and likewise for diabetes. So even where it would be, we understand that there may not be a NAFLD or NASH strategy in a country or even a liver disease strategy in the country, but even when there is diabetes or obesity, we find that fatty liver disease is not addressed even in passing in those strategies. And that's a first place where we can take some action. The foundation has been working with Wilton Park and the Economist Intelligence Unit to broaden our scope and have a truly global participation and involvement in addressing fatty liver disease from a public health perspective. We held the first ever event taking a broad public health approach to NAFLD with over 50 experts and practitioners, including from the World Health Organization, as a part or held at the think tank Wilton Park. And the event report outlined some of the key steps and actions for a NAFLD roadmap, and key recommendations were made. There'll be another event following that here in December, but you can see the report at that link on the bottom left. And together with the Economist Intelligence Unit, we took a deep dive into the opportunities and challenges for addressing NAFLD in Latin America, Asia, and the Middle East. 55 regional experts engaging in 14 workshops over 12 months, all held virtually, unfortunately, due to the COVID-19 pandemic. And again, there's a report there, and it details key calls to action across a range of areas, from models of care to integration of NAFLD into non-communicable disease activities. To meet the care needs of people living with NAFLD, we're going to need to take a multidisciplinary approach with increased coordination and collaboration among disciplines, but there's a dearth of guidance of how to develop models of care. We carried out a systematic review of the peer-reviewed literature to identify, which only identified 7 published examples of comprehensive models of care that answered 4 key questions: what services are provided, where are they provided, who is offering them, and how are they coordinated and integrated within healthcare systems. A recently published paper, you can see the source at the bottom, synthesized the findings into 8 recommendations nested within the what, where, who, and how of care models. The recommendations are of relevance to policymakers and practitioners designing and implementing models of care, and can help to address the increasing need for the provision of good practice for patients with NAFLD. Here you see the 8 recommendations: to establish clearly defined care pathways that are tailored to assessing the stage of the disease, to develop guidance on screening and testing, including with non-invasive tests, to develop guidance on treatment strategies for patients related to their disease strategy, and to outline actions for preventing disease progression in primary care for patients with early stage disease not requiring specialist hepatology care. Where should these services be provided? Well, the 5th recommendation was to articulate and define the roles and interactions between primary, secondary, and tertiary care providers. And the 6th was to establish where services for NAFLD could be co-located with services for the treatment of common comorbidities. Who should these services be provided by? Define the composition and structure of the multidisciplinary teams responsible for managing patients. And finally, the 8th recommendation is to establish effective systems for coordinating and integrating care across a healthcare system. Very little attention has been given to NAFLD by the global public health community, as I mentioned, but the scale of the problem calls for a coordinated, globally supported response. To support this, we set out to develop a consensus statement and a set of recommendations that can form the basis of a global NAFLD roadmap. We engaged a multidisciplinary group of 218 experts from 91 countries to participate in a Delphi study. A core group of 33 experts drafted the consensus statement and recommendations, which the larger group responded to. And over 3 rounds of voting, experts provided feedback on the consensus statement and recommendations. The statements and recommendations address a broad range of topics, from epidemiology, awareness, models of care and treatment, to public health policies and leadership. And these findings will be of broad relevance to a wide range of stakeholders. The focus will now shift as we develop a roadmap which can support national and local efforts to address the public health challenge of NAFLD. Work in some of these areas has already started. And here you can see the consensus statement recommendations, which is in press and should be out any day now in Nature Reviews GastroHep. I won't read all of these recommendations, but I will encourage you to look at the article when it comes out and see which recommendations are most relevant and most actionable for your particular setting. So in conclusion, we have a long way to go to make NAFLD a public health priority and ensure adequate responses from the local to the global level. There is, however, cause for optimism. We're seeing a greater momentum than ever before and a growing coalition of experts across disciplines ready to advance this agenda. While NAFLD is not a priority in sub-Saharan Africa, we need to take steps now to prevent it from becoming a major issue in future. The first step is to embed NAFLD into current and future efforts to tackle non-communicable diseases more broadly. A national or subnational NAFLD or liver health action plan can be a helpful starting point to guide and drive action from data and public awareness to policies and guidelines. I'd like to acknowledge the ISO International Liver Foundation, in particular Massimo Colombo, Henry Mark, and Marcella Viotto, the latter two at the Secretariat, and a special thanks to the 218 experts who contributed to the consensus statement, including those from Sub-Saharan Africa, to Quentin Anstey and Adam Palayu for their work on the NAFLD Policy Index, to everyone at Wilton Park, the steering committee, and in particular Nancy Lee and her team, and to the Economist Intelligence Unit, including the more than 50 participants and guest speakers from around the world. Thank you for your time.